So there was this shocking announcement last week. Princess Kate announced that she is undergoing chemotherapy for cancer.
In her message, she said she learned about her cancer diagnosis after her abdominal surgery this morning. Dr. Meir, an American Cancer Society spokesperson, joins us to talk more about her diagnosis. Good morning, and thanks for joining us here on Houston's Morning Show.
Thank you very much for having me.
Even though she found out about her cancer after that surgery, it doesn't mean she has stomach cancer, right? We haven't heard much about what's happening here, but that is a lot of concern from people we're hearing from.
Yeah, it does not mean she has stomach cancer. When we think about the major abdominal surgery, the things that we think about is it could be intestinal cancer like colon cancer, which is very common, or gynecological cancer like ovarian cancer. Unfortunately, these cancers are usually sometimes diagnosed after the surgery. The surgeons see a lump or inflammation and go in and to remove it. And sometimes a couple of weeks later, the pathologists find cancer cells in that tumor or a lump in the background of inflammation. So it's not unusual to see this.
So I know it took a little while, because I remember we announced that she was going through surgery maybe a few weeks ago, and then we learned that she actually has cancer this past Friday. In terms of a cancer diagnosis post-surgery, why does it take so long to actually get that diagnosis?
Sometimes, when you do not really see obvious cancer at the time of surgery, the surgeon sends out for the pathology review, and the pathologist usually takes about a week or two to really nail it down, the diagnosis, if you really see cancer cells. On average, it takes about 1 to 2 weeks for the final results of the pathology. I presume she had surgery in early January and probably had the results by end of January. And in her message, she did say that she started chemotherapy about a few weeks ago or a few days ago. So I would think it took some time, but about 2 weeks is what's approximately we expect after surgery to learn the diagnosis of cancer.
And we always hear of patients often undergoing chemotherapy. In this case, it's being called preventive chemotherapy. That usually takes place after surgery, so they sort of go hand in hand to try to make sure those cancer cells are zapped out of the body and don't come back.
You're exactly right. So when the cancer is removed, especially if it is a stage 2 or a stage 3 cancer, there is a high possibility of microscopic cancer cells that's left there or could not be completely removed by the surgeon. So we give chemotherapy, we call it adjuvant chemotherapy, for a few months after surgery to annihilate or kill any cancer cells that's left behind. Microscopic environment is clean from the cancer standpoint. That has shown to significantly improve the cure rate, the survival, and also prevent the cancer from coming back.
Yeah, just 42 years old. You're definitely praying for her and thinking of her and the entire royal family, for sure. Dr. Meir, we appreciate